my name is Molly Bigford. I'm a dietitian for Spectrum Health in Grand Rapids, Michigan, and I'm going to be talking to you today about the updated in-service for RELiZORB use, including the 2020 label change. I have been a clinical dietitian for over 16 years, and I've worked with the cystic fibrosis population for over 9 years. I've been using RELiZORB since it first came out. I love it, and I'm excited to tell you about it and teach you how to use it. RELiZORB is designed to break down fat from tube feeding into its digestible form. People may not be able to break down fat on their own for a variety of reasons. For example, surgical interventions such as post-Whipple procedures or trauma to the GI tract or pancreas can result in inadequate delivery of enzymes. Side effects from medications such as tetracycline, some antacids, phenytoin can also result in fat malabsorption. When we think about the critically ill, any multi-organ dysfunction can limit the ability of the pancreas to secrete enzymes. Studies have found that more than 50% of critically ill patients who did not previously have pancreatic insufficiency can develop a deficiency of these enzymes in the hospital. And lastly, but also the first thing I think of with fat malabsorption is due to deficiency of pancreatic enzymes, specifically lipase. There are particular gastrointestinal symptoms associated with fat malabsorption. These include diarrhea, steatorrhea or loose greasy stools, abdominal pain, nausea, bloating, and even constipation. These side effects are caused by incomplete breakdown of fats, especially long-chain triglycerides, which can ultimately lead to malnutrition, weight loss, muscle wasting, deficiencies in essential fatty acids, and an overall decreased quality of life. This is especially significant for the critically ill patient when lack of nutritional intake along with GI dysfunction ultimately leads to worse outcomes. I'm aware in my experience as an inpatient dietitian that there are many different ways we try to treat GI issues if someone is on tube feeds. We may reduce the tube feeding rate or stop the tube feeding altogether. We might add fiber to help bulk the stool. We can change standard formulas to elemental formulas. We can add pancreatic enzymes. And if all else fails, we may have to resort to TPN. Considering the multiple modalities you can use to address GI symptoms, none of them will help if a patient is a malabsorbing fat. For example, enteral formulas do not come with prehydrolyzed fats, as they are unstable and spoil quickly. Additionally, oral pancreatic enzymes are not meant to be used with enteral feeds. They should never be crushed or added to enteral regimens, and they're notorious for clogging feeding tubes. Before participating in a pivotal trial, cystic fibrosis subjects were using tube feedings for over 6 years and still had plasma concentrations of omega-3 fatty acids that were 60% of normal healthy humans. They also had BMI or BMI percentiles that were below target for patients with cystic fibrosis. This tells us that patients weren't absorbing the fat in the tube feeding and were not clinically benefiting from it. RELiZORB was specifically designed to break down fat in the tube feeding before reaching the GI tract. Lipase is bound to small beads inside the cartridge and are kept there by 2 filters. As formula passes through the cartridge, the lipase breaks the fat into absorbable fatty acids and monoglycerides, which the patient can then absorb. The clinical studies that have been performed using RELiZORB revealed that patients had rapid and continuous improvement in fatty acid absorption, an overall reduction of gastrointestinal side effects, including no reported incidences of diarrhea at day 90 in one of the studies. I personally have been witness to improvements in gastrointestinal side effects once patients switched from oral enzyme therapy to RELiZORB. This slide reviews RELiZORB versus oral pancreatic enzymes. RELiZORB is indicated to hydrolyze fats in enteral formula for use in pediatric patients ages 5 years and above and adult patients. Oral pancreatic enzymes are not designed for use with enteral nutrition. Also, RELiZORB has been clinically proven to reduce diarrhea, improve weight gain, and overall fat absorption, whereas no clinical trials have been used on oral pancreatic enzymes in enterally fed patients. And as mentioned previously, there have been no clinical trials done on oral pancreatic enzymes in enteral nutrition. RELiZORB is also very easy to use and set up. whereas when using oral pancreatic enzymes with enteral nutrition, they're very difficult to administer and they have a high risk of clogging. Lastly, even though it's not on this slide, RELiZORB does not count towards the max daily dose of lipase, as when using oral pancreatic enzymes. Setting up RELiZORB with the tube feeding system involves 4 easy steps, which I'm going to go through with you now. First, for volumes up to 500 milliliters, connect one RELiZORB cartridge to the end of the primed feeding pump tubing set. For volumes greater than 500 milliliters and up to 1,000 milliliters, connect 2 RELiZORB cartridges in a tandem configuration and then connect to the end of the primed feeding pump tubing set. Second, connect the RELiZORB outlet to the patient extension set or enteral feeding tube and manually prime through the device. Here are some pictures of a single RELiZORB setup and a tandem RELiZORB setup. And note the Christmas tree adapter in the green circle, which you can use if the tubing is not ENFit compatible. Step 3, if using a patient extension set, prime the feeding formula to the end of the patient extension set and connect to the feeding port. Step 4, set the pump to the prescribed flow rate and proceed with the feeding. At the end of this presentation, I'll be demonstrating these steps for you. RELiZORB has been tested and is compatible with multiple enteral formulas, of which you can find a complete list at RELiZORB.com. If you do not see your formula listed, please reach out to the company. RELiZORB should only ever be used with enteral feeding and never IV or medical tubing. So just some warnings and precautions in regard to RELiZORB use. Remember that RELiZORB is only indicated for use with enteral feeds. It should never be connected to IV lines or medical tubing. Medication should not be administered through the RELiZORB cartridge, as it can affect the medications themselves or the ability of RELiZORB to hydrolyze fats. Fibrosing colonopathy can be caused by excessive porcine-derived pancreatic enzyme capsule ingestion. Because the lipase within RELiZORB is not derived from porcine and is retained within the cartridge, the lipase in RELiZORB does not count towards max daily dosages of lipase. RELiZORB is a single-use product. Reusing it may result in contamination of the product and may not effectively hydrolyze fat in the tube feeding formula. You want to be extremely careful with the RELiZORB cartridges. Any compromise of the structural integrity of RELiZORB may lead to improper connection to the enteral feeding pump tubing sets, causing leakage or risk of contamination. Do not use RELiZORB after the date marked on the pouch, as they do expire. Enteral formulas containing insoluble fiber should not be used. A detailed list of enteral formulas compatible with RELiZORB can be found at www.relizorb.com/formulas. RELiZORB is designed for use with enteral feeding pump systems with low flow or no flow alarms. RELiZORB is not intended for use with gravity feed systems. For a detailed list of compatible pumps and tubing sets, please visit www.relizorb.com/pumps. RELiZORB should be stored in its pouch either at refrigerated or room temperature. And remember, RELiZORB is indicated for use with enteral feeding only. Patients should continue to follow their physician's guidance for pancreatic enzyme replacement therapy with any oral intake. I'm now going to demonstrate how to connect your RELiZORB cartridges to your tube feeding extension. All tube feeding sets will come with a Christmas tree adapter. And you can remove this if your tube feeding set or the patient's tubing set is ENFit compatible. Every RELiZORB cartridge is indicated for 500 milliliters of tube feeding. To connect the cartridge, use gently but firmly twist the RELiZORB cartridge onto your ENFit adapter. You do not want to tighten too much, as you can impact the structural integrity of the cartridge. For 500 up to 1,000 milliliters of formula, you can add a second cartridge in a tandem configuration. You'll then add your Christmas tree adapter by twisting it on. You then will connect to the patient's feeding tube. Now, if your patient's feeding tube happens to be ENFit compatible, you do not need to use that Christmas tree adapter. Medication should not be administered through RELiZORB. You can administer it after the cartridges or via the Y port if your patient has one on their extension. According to the updated label, there are a couple items which can be very helpful. Tube feedings can now be held for up to an hour when using RELiZORB cartridges. This means that your patient can go down for a quick procedure or go work with therapy, and you can come back and restart your tube feeds at the same rate without any risk of clogging the cartridge. Secondly, there is an expanded rate allowance from 10 milliliters per hour up to 120 milliliters per hour, which will help accommodate more patients.